Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sian. Thank you so much, as always, guys, for taking the time to join me here to learn and to grow. I am always so grateful for all the support, all the liking and the sharing and everything that you do. And of course, I always ask this one favor right off the top. If you do get some value from this, please share it. Send a link to a friend, put a link on LinkedIn, put a screenshot up on Instagram and tag us. Let us know that you were listening and what you took away from this conversation. We are gonna have another amazing conversation with our amazing friend, Dr. Claudine Courey, my favorite returning guest. We're making this a series. Claudine's just coming back at least once a year. We're gonna see what's up, updating us on her life, because there's always such exciting things going on with Claudine and Eye Drop Shop and all the other stuff. So we're gonna talk to her about this. And today, just a little sneak, today's conversation is unscripted, okay? I know usually I like to lead off the top. We're gonna talk about this. It's gonna help your business. It's gonna help. There's always gonna be something when you talk to Claudine that is gonna be worthwhile listening to. That's a guarantee. So today's conversation is unscripted. It's gonna be a little looser maybe than other conversations that we've had, but it's gonna be fun and it's gonna be valuable. I can guarantee you that. Before we dive into the conversation, I wanna say a big thank you. If you're watching this video, you are seeing how beautiful the setting is that we have here. We are at the White Oaks Resort in Niagara-on-the-Lake, in Ontario, for the OSI Summit, National Summit. So big thanks to OSI for having me here, for giving us the space to record. Also a big shout out to our amazing production video team here, LCA Productions, look at this, the way they set things up. Anywhere, I give them a dim, dark little room and they turn it into something that looks glamorous. Now we have this beautiful venue to start recording. So I want to say a big shout out to them as well. Thanks for this. So Claudine, the lady who needs no introduction, but I'm going to let Claudine, why don't you give a little introduction, at least just for those who may be not super familiar with who you are.
Sure, I'm Claudine Courey. I practice in Montreal. I work in an ophthalmology setting, so in an ODMD setting, doing dry eye. That's kind of my passion. That's what I've been doing so much lately. And a long time ago now, I opened a company called Eye Drop Shop, which supplies eye care products to anyone who needs it, and also that really gives access to cool things for doctors to do in practice. And that's kind of the fun part and what we're doing here today at OSI with our booth and all that kind of stuff. Yeah.
So that's amazing that Eye Drop Shop is partnering with OSI now, and you guys have a booth here. I feel like you're really underselling yourself. Okay, so if you're not familiar with, Claudine is like dry eye guru extraordinaire. So all things dry eye. I'm calling Claudine first usually if I'm like, Claudine, how do I treat this patient? What settings should I use for IPL? So Claudine is that person in clinic. And then Eye Drop Shop is this, really, I think most people know Eye Drop Shop. And even if they're not super familiar with everything it does, like I'll bring it up with an associate doc and be like, oh yeah, my friend has this website, Eye Drops. Oh, and they'll say, oh, I know that website. Everybody, bar none, like, oh, I know that website. And we just all know that it's there. So, but tell us, okay, how is Eye Drop Shop, different ways it's relevant, right? So of course a patient can go on Eye Drop Shop and just buy their eye drops and other dry eye products and nutraceuticals and whatnot. But what's the other way that ODs can access Eye Drop Shop?
Well, the whole idea behind this is that I am an OD, right? So, and I love working with my colleagues, and I made it so that ODs can have access to everything that we carry within their platform. So it's like your clinic can sell everything that we inventory in our warehouse space, but you don't have to stock it and stuff. So we're able to partner with ODs so that they can have their own online store and be able to do this and just not carry the inventory. Because the thing that I was noticing was that everybody or the patients wanted to get stuff, and I didn't want them to go on Amazon and buy eye drops either, because as we know, it could be, whatever being sold there. So we partner with ODs in that way to give them sort of an ability to have their own online site, but also we retail directly to them so that they could sell in clinic, like all the clean beauty stuff. And basically it was like, all the stuff that I wanted in clinic that we didn't have. Selfishly, I'm like, oh, I'll just go find this. And then I started putting it on Eye Drop Shop and then saying, hey, I'm using this in clinic. If you want it, you could, it's accessible now. Yeah. So
that's funny. I do that with the podcast, right? So if there's a topic I want to learn about, I'm just going to bring that person on the podcast. And then A, I get content, and B, I get to learn. Clean beauty is one of the topics we've spent some time talking. So was it last year or 2 years ago? 2 years ago, we did like a series of talks. Yeah. And one of them was specifically on clean beauty. I think when we were in Quebec City, that was the one that we recorded. Yeah, so if you're like me and you don't really know how to broach that conversation with patients about their eyeliner or mascara or other products that they're using, go back and listen to that episode with Claudine, because she gives us some good tips on how to at least begin that conversation. And then recommendations to make, because of course she has these products on her website and uses them in clinic. So you are, what's the right word, you're the distributor for certain brands?
Correct.
So if I wanted to bring a certain clean beauty product into my office, it would come through you.
Eye drop shop, yeah.
But I'm really interested in digging a little bit more into the online stuff. So if I wanted to sell something, but I didn't want to stock it in my office, I would have eye drop shop sort of be on the back end of my website or something somehow. And so a patient would go online, order it, and it would ship directly from eye drop shop to the patient, or come to my office?
Exactly, that's like the whole advantage to it, that you could have access to the 200 plus SKUs that we have. We did partner with Auto, remember? We also brought that up on a podcast, so Auto makes it very easy to be able to do that.
Okay.
And it just means that you could kind of show that you have all these products, but you're not physically taking up space in your clinic to warehouse them. So
that's huge.
I think it's a really cool option.
That's huge. And is that's done through Auto?
That's done through Auto.
Okay.
There's also, there's a bunch of ways to do it ultimately, but I really love Auto. I think they do it well, and it's very easy and seamless to go through them. But
shout out to Alex.
Shout out to Alex for sure.
Yeah, we use Auto as well, and our staff really likes it. And it's a nice, at least, way to say to patients, if you want to buy more of this, you don't have to come to the office. You can. Here's the link, go to our website.
But it brings the patient back to your clinic website for those touch points, so that like when they do need something in the future, they think, oh, I'm going to go get it there, as opposed to, oh, I'll go get it at a random, let's say they're going away and they want to get sunglasses, they'll remember that they'll come to your clinic and get glasses or whatever. There's like a huge trickle, if we talk business-wise, there's a huge trickle effect of staying top of mind in your patient's email even, right? Yeah. So these are just different ways to have touch points, and I think that's
that touch point is a key word. I think is so important, because otherwise, I did an episode with Wes a little while ago, and that was one of the things with Wes is we were talking about patient journey, and we think about patient journey as like when the person walks in the door and then walks out the door. That's the patient journey, but it's actually when they're at home, when they're looking to book an eye exam, when they're looking to update something or other, buy new contacts. These are all places we need to be top of mind for them, and this gives us a chance to do that.
Yeah.
So that's really great. So what's exciting and new with Eye Drop Shop?
What's really cool and new, and which is actually launching today, so
brand new.
brand new. Like it'll be launched by the time you air this. Is now we're bringing in an in-office treatment for doctors, which is called Rinsada.
Okay, I've heard of that.
Yeah, so it's been in the States.
So this is new to Canada now?
New to Canada,
I got you.
and we're launching it exclusively.
Wow.
So, and it's so easy also. Like, so again, I always bring it back to how do we want our information delivered? Like let's say you're scrolling at night, or we're all kind of looking online. So all you have to do is, it's on the wholesale side of Eye Drop Shop. We have our own, you log in. And so you'll see like Rinsada, and you could just order it there. It gets delivered to your clinic. And I love this because it's a natural treatment that'll help flush out any kind of allergen or debris or anything in the eye. So I'm very big, we did that whole podcast on dry eye and how we treat it and stuff. Yeah. And so I love to prescribe an antibiotic or a steroid like anybody else, right? But if I could get the body to kind of do what it has to do on its own, I'll always like make that a priority. Because I don't want people to be dependent on things ultimately, because we don't want to be dependent on things, and we always have to kind of think of our patient as they're going home and what are they doing, and we want to minimize that friction point, Yep. So we're selling it directly on the wholesale of Eye Drop Shop, so it comes in your clinic. And what it is, which we'll do like a bunch of demos. Yeah. So
are docs who are walking around the trade show going to be patients?
Oh, 100%.
Okay, so maybe I'll come and get it done.
You must, yes.
Okay, I'll get it done. We'll film that.
The doctor who invented it is actually here today.
Oh, good. Okay.
So he came up, Dr. Srini. He is a retina specialist, and he invented this because essentially he wanted all of his patients to have like an even betadine wash before his surgeries.
Oh, I see.
And so it's like a little hook that you put. Who did you see?
Patrice.
Oh, Patrice.
Yeah. This is what happens when you film out in the open. You're going to see people you know, and you're going to say hello.
Patrice, shout out to Patrice.
Shout out to Patrice, who's the president of OSI.
Of OSI.
So he's walking around, of course, doing his thing. All right, so tell us.
Sorry. So yes, so it's a hook that goes underneath the upper eyelid and retracts the upper eyelid, and then you get like a steady stream of saline or whatever you put in the syringe, exactly. But it comes already preloaded. So there's 2 syringes and the retractor all in a
so it's single use.
Single use.
Okay.
Single
and
use.
it's saline. It's
saline.
Just straight
it's a
saline. There's no other
flush.
concoction. Okay.
But if you think about the anatomy of the eye, right? A lot of our patients are like, can our contacts get stuck behind our eye, right?
Yeah.
And I'll say, no, there's a dead end.
Yeah.
So it'll get stuck in that dead end, but everything else gets stuck in that end, that dead end. It's kind of like gross, right?
Yeah, makes
so
sense.
all pollen and debris and any kind of like inflammatory mediators can get stuck in that little dead end. So what you're doing is you're flushing it. I mean, it's like a saline rinse for your nose. You know how they always tell us to do that? It's the same concept as washing out, flushing the surface. And it's not like, oh, it's a cool idea. They did a bunch of studies. The MMP9 went to 0 in a lot of patients. And on the page, I put all those studies so docs can read them themselves, you know? Yeah.
So that's really interesting. I was wondering why a retina specialist would think about the ocular surface in that depth, but it makes sense. He needs a clean, even betadine wash because they're going to be doing all the stuff they're going to be doing. So, okay.
That's cool.
Interesting. So there's studies that show, of course, the effectiveness, reducing MMP9, reducing allergens and things on the ocular surface.
Right.
Can you speak to how long does that effect last? Like, let's say it is allergy season and somebody has pretty regular, allergic conjunctivitis. Like, how many times in a season would somebody need to get this done? Yeah,
the thing is, it's hard to say now since I also personally have no experience with it because we're starting.
I gotta ask.
But if we base on what they've been doing, I mean, it's saline, so you could do it as often as you want, right? It's not gonna harm. It could only kind of do good and make the patient feel better. So I would personally do it once, and then I'm gonna, on my own, try like my little in-house study and see how long I could milk it until the patient feels like they need it again. I'm thinking in my mind, maybe 3 months, but I'm always like, if I could wait and not have to do an intervention, I space them out, With IPL, I'm a bit more regimented, but like maybe I will, by the next time we chat, have a more regimented protocol.
Got it. Well, we know it's been out in the States for a while, and I know some of our really amazing colleagues in the States have been using it and speaking very highly of it.
Right.
Some of our friends who are into the dry eye space, especially, or ocular surface, and maybe we can, if we need to, we can refer to them and see. But otherwise, of course, during the trade show today, we'll be walking around. I'll be going by the booth, and maybe we'll film some content around that. So maybe I'll release some content. But I think also it might be good to have the founder. What was the founder's name again?
Dr. Srini Kondapalli.
Okay.
Yeah.
So good to have maybe Dr. Srini on at some point.
Oh, that'd be fun for sure. He'd love it.
So, okay, what else? I like, you pivoted a little bit to the business conversation.
Yeah,
that's one thing I love talking about. Anything else you want to share with our friends out there? Let's say associates or business owners, ways that we can elevate our business from your perspective, from dry eye perspective, from eye drop shop perspective.
I think that what I'm noticing, because I speak to a lot of business owners through, meaning clinic owners, through eye drop shop, because if any doctor has a question, I will take the phone call. Like to this day, because I also, like you, I just love chatting with my colleagues and kind of getting to know them and stuff like that. And I think if we could, as a community, just get over the being shy to propose things. I think that would be, and just realize that we are not selling. It's such a message I'm trying to get out there. We are not selling. We're not selling cars. We're not selling items that aren't helping or whatever. I don't know how to put it. Cars are helping, but cars get us somewhere. I mean, but we are giving our patients the option of a solution for a problem that they have. Then the patient, it is their decision if they want to do it or not.
Right.
But you can't be that doctor who doesn't give them the option. Because then they come to me and they're like, why did nobody tell me? And then I go, oh, maybe it wasn't available at that time, or I always cover because we're all buddies.
Good. I'm glad that you do that.
Of course.
I think there's maybe we won't go down that path. But anyways,
no,
I'm glad
of
that
course. Even like, I don't want to be, I don't know how you feel, but I hate feeling like that when the patient comes in, well, how come this doctor never spoke to me about that?
Yeah.
And I'm like, your ocular surface can change between last time and this time and blah, 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 which is true. It could.
Yeah.
But like, look, we're all a team.
Yeah.
We're like, we got to work as a team. We're a small community of optometrists. I mean, I went to University of Montreal. We're like 40, right? Yeah. And we work so well together in Quebec, like us together, and then cross country, that I really do believe that, one, if I could pass out the message that you are helping your patients, you're not selling things to them that they don't need. You are addressing a pain point. They are telling you they are suffering. So I would argue that not giving them a solution is worse.
Yeah.
Right? And then if you in your own mind feel like something's expensive, don't project that bias onto them. It is up to them to decide. And this is how I'll frame it, genuinely, and I've told you this before. I'll say, I am going to give you all the options right now. Then at the end, you and I are going to decide in what order and how we can make this happen so it's comfortable for you.
Yep.
And then the patient is usually so happy because I'm like,
Yep. Knowledge is power. At the end of the day,
Yes.
we have to provide that information, and you're right. We have to give the patient the best opportunity to make the right decision, and what decision they make after that, we go with it. But that piece of advice is so relevant, not just in dry eye, but we're going to be doing a myopia management talk later today. It's relevant there as well. Pretty much any aspect of your business, to be honest. When you're recommending ophthalmic lenses, progressives, whatever it might be, you always need to educate the patient on what are the options available and how they'll be providing value to the patient or serving a need, and then let them decide based on that. I think that's so key.
Absolutely.
Very, very important.
Absolutely.
Okay, good. There was something else I wanted to ask you now. This is what happens when you're not scripted.
It's okay. This is your show. You can do whatever.
Show. You know what?
This is almost your you've done 200.
Yeah.
This is probably like 205, right?
This will be, something like that.
Something like that.
Yeah.
Can I ask you a question?
Yeah.
So when you started all of this, okay, Baby Harbir,
Harbir?
Baby Harbir,
Okay,
like the beginning, what did you envision of where this was going to go, and like how did that change over the course of like today, or what surprises you today about it?
What surprises me today is still, after 200 episodes and this many years of doing it, that people come up to me like at a place like this and say, hey, I've heard your some people I've never met before, of course, come up to me and say, I've heard the podcast, or thanks for doing the pod. The thanks is a really nice one, but thanks for doing it is really, really amazing. So that's still, to be really humbled by that, I think is really the amazing thing. How it changed, it definitely has changed. So, okay, I try to be really transparent about this with people, because in general, I always want to make sure I give the most truthful answer and the most raw answer, because then I think it helps the most, right? Versus me trying to sugarcoat it or make it look like I had some master plan to begin with. It started in I'm going to give you the long version, of course, because I'm a podcaster. This is what we do. In 2018, I was trying to build a bit more of a presence for myself in the industry. I wanted to get more speaking opportunities or whatever, connections as a KOL, whatever it might be. And I realized that in clinic, I didn't have a high level of expertise in any one given area. Like maybe I knew lots about contacts, soft contacts, not specialty. I was doing a little bit of dry eye, but not like any real level of expertise where a company would want me to go around and be a speaker. So I thought, what do I have at my disposal? I'm pretty good at social media. I'm starting to build that presence. Let me keep leaning into this digital presence. And I know that companies and other optometrists are going to need to learn about this, so I'll become that person.
Yeah.
And at the same time, I was listening to a lot of Gary Vee, Gary Vee?
Yeah, of course.
And Gary Vee, probably still, I don't listen to his stuff as much now, but back then was like, everybody should have a podcast, right? If you want advice, like I do this now still, selfishly, as I said, if I want to learn from somebody, I'll invite them to come on the podcast.
Yeah.
And so I thought, okay, well, let me, so-and-so big name, hotshot, won't give me the time of day over the phone, but I'll say, hey, I have a podcast. Will you come on my podcast?
Cool.
I'll learn from that person, and it helps me look better because I say, look who I was just speaking to,
Yeah.
right? Just talking to Claudine, like, look how cool I am. And so that's where it started.
Cool.
Within a couple of years, it took a little bit of time of slowly doing that, and those KOL opportunities did come around, and those opportunities to speak did come around. But then the podcast shifted from self-serving to actually now how can I support the profession. And that's really the number one driving force behind the podcast is what conversations can I have that are going to help optometry grow, help us move forward and thrive. So we have a lot of these conversations about scope modernization. We have a lot of conversations about, what are your intentions, big corporation, in optometry? How are you going to help support our profession in the future? So that's where it's at now.
I noticed that because I was I listened to every one of them, and I'm a big fan.
Thank you.
And I did notice a shift throughout your career where it was getting more like you were asking like the tough questions that we all wanted to hear, and you were doing it. That entire series that you did was really impactful for our profession.
Thank you.
And I have another question if you're not going to kill me.
That was a big turning point.
Yes, right?
Yeah.
Do you find, how did you feel about that one?
I was nervous doing it.
Yeah.
I was, yeah. I was anxious, I was nervous, I was sweating. Luckily, they were all virtual. None of them were in person.
No one could smell you?
Yeah, exactly.
Gross.
Hey, there's studies on that.
Smell-o-vision?
That people can smell fear in sweat.
I believe it. I believe that.
Okay, please correct me if I'm wrong. If anybody, I swear I've read this study somewhere.
That's so funny.
They had people jump out of I think, what do they do? They had people jump out of like an airplane or something, and
I did hear this.
And then they had
the
people
different
sit
kind
in,
of sweat.
Yeah, they had people sit in an MRI machine and then smell other people's sweat.
Cool.
And then
study.
different parts of the brain were triggered based on the different sweat. Like
love it.
Whatever, playing sports sweat or jumping out of an airplane sweat. Anyway, so just in case you feel like you're sensing something from somebody, you might be onto something. Anyways.
So you were nervous, but you did it, and then you must have gotten some good feedback.
I did get a lot of good feedback from that. Yeah, those were some of the most listened to episodes by far of the podcast, and certainly I saw a big uptick in overall long-term listenership in the podcast from that.
Because that was like a risk, but it paid off.
It did.
Which I think is a nice lesson.
Some companies don't want to come back on my podcast after that.
Ooh, juicy.
Yeah.
I love that. That means you did it right.
I think so.
Yeah.
I was even confronted in person after.
Physically?
Well,
are we okay?
Not like assaulted, but confronted at conferences about, hey, how come you're asking these questions? How come you're making it seem like we're not good people? I was like, it's not that you're not good people. I asked the same questions to everybody who came on the podcast. Yeah. 6 or 7 guests from these different organizations. Some people didn't like the way it turned out. Some people did. And some people confronted me in person. One thing I'll say about interviews like that is it's not just what people say in their answers. Sometimes you have to hear what people are not saying to really understand where they're coming from.
Absolutely.
I think that's a lesson that I've learned.
That's a good one.
Yeah.
And so you have spoken to all 200 people and easier and harder and stuff.
Yeah.
You know how I was saying 2 seconds ago what I want all optometrists to kind of feel, which was more geared towards, I don't know, like their overall demeanor and proposing products and proposing services and things like that.
Yeah.
What do you think optometrists need to hear? Either emotionally, throughout the thread of it. I know, but
by the way,
trying.
we flipped the script and we didn't even warn the audience. Claudine's flipping the script on me.
I flipped the script.
Okay. What was the question?
They don't get annoyed.
What do ODs need to know?
No, what do you think they want to hear, or what do you think they need to hear in this day and age of this kind of? You've interviewed everyone about scope. You've interviewed hard questions, easy questions. What's coming out? Who, whatever.
Okay.
If you don't like the question, we could edit it out.
No, it's now I understand how guests feel, but usually I tell guests what I'm going to ask them, at least roughly, except this conversation. This one was unscripted. Okay. I have an answer. No, I'm not mad, because I have an answer, but okay, if I'm going to be really, really honest, this is something I throw into some of my lectures. There's a podcast I used to listen to called the MF CEO Project, and I joke MF doesn't stand for multifocal. Okay, so the premise of the podcast was brutal hard truths that we need to face ourselves, and we need to be the CEO of ourselves.
Yes.
Okay, we're business owners, and maybe some of us who are listening are not, we're associate doctors, whatever it might be, but you don't have to be the CEO of a business, you need to be the CEO of yourself. And sometimes you need to give yourself a good hard look in the mirror and say the hard things to yourself. And truthfully, I swear at myself sometimes, not all the time, I'm not mean to myself. Sometimes I just need to look in the mirror and say, listen, man, get your S-H-I-T together.
Yeah.
Because nobody's going to come and fix this for you.
Yes.
You have to fix it for yourself, right? And so we need to have those conversations with ourselves. So I'll do this sometimes, and I'll call it my Tony Robbins moment. Sometimes I'll do these when in lectures, and I'll say, okay, I'll say to the audience, okay, we're going to take a moment, and I'll walk through the audience, I'll walk through the tables, and I'll say, okay, guys, think to yourself, one thing that's not working for you right now. Is it your business? Is it a relationship? Is it you're not in shape? Is it your diet? One thing that you're unsatisfied with, I won't say unhappy, unsatisfied with right now in your life.
Yeah.
Give them a moment. Okay.
I'm going to do it now.
Okay. Now, what if I said to you, that is all your fault?
I love hearing that,
right?
But I'm sick.
Okay, but like there's limits to that. Now, I don't want somebody to feel really horrible about it, but there's power in that. Mm-hmm. Don't think of yourself as a victim. If it's all my fault, that also means that it's all up to me to fix it. I have the power to fix this situation.
Yes.
And I think that's something that I like our friends and colleagues to think about in their business or whatever, and in our profession as a whole. If we're in a place as a profession that we don't like, it's up to us to fix it.
I love it. That's so helpful. And it's so true that we all kind of just have to, I think, also not take things personally and look at ourselves objectively and be able to do that, which is exactly what you're saying.
Objectively is very key. I think we put too much emotion on on a lot of these things. Yeah.
Totally.
But thanks for that question. You gave me a great hot take. I think we're going to chop that up.
Yeah.
That's going to go on social media.
Perfect. I gave you a little clip.
I appreciate that. Thanks.
I'll stop now.
Is that all the questions? Okay, thank you.
No, I had one more.
Okay, go ahead.
And
we got a couple more minutes.
50% of your audience will adore this question.
Okay.
Okay?
Uh-huh.
It's
and
a good
the
one.
other 50?
The other 50 will think nothing.
Okay.
Yeah. So, you have 2 clinics.
Uh-huh.
You have a thriving podcast. You are, known in the community for all the things that you do well, and you still practice in clinic, and you're a dad. How do you balance it all?
Oh my gosh.
Because that is the question all moms get. You're a dad boss, so how do you do it?
Thank you for all the very nice things that you just said. The answer to that question is I have a lot of help.
Yeah.
That is the number one. So that starts with my wife.
Yeah.
Shout out to Pam.
This was just like a softball to like hit it out to Pam.
I love you. She's amazing. It starts with that, 100%. Like she's a boss in her own right, and gives me a lot of support. And everything I do, I run by her. What do you think of this idea? What do you think if I do this? And some things we do where it's like, okay, that seems like a good opportunity. Maybe it didn't turn out to be, and at least we tried it as a team. Mm-hmm. Then the support goes beyond, like I have a business partner in the office, and she really holds down the fort in the clinic. And then beyond that, family support and all this kind of thing. That's the only way it's possible.
Truth. That's the truth.
So thanks for the questions. Now get out of here. It's my podcast.
Okay, go. Flip it around.
Okay, last one, then we're going to wrap it up. What I want to do is I'm going to go back to the old questions that I think you've answered, but maybe your answers will be different.
Okay, let's see.
If we could go back in a time machine.
Yes.
To a point in your life that was difficult.
Yes.
What advice would you give yourself at that time? So if you want to share the difficult thing, you can share that. And then what advice would you give to
This is a hard one for me every time.
Yeah.
Really. Because a few things pop in my head. I'm like, which one do I pick? Tricky. You're not flipping it. You're not switching me.
I'm not. No, that's the question.
That's the question, and I got to do it.
Okay, if you want to let's flip it. Just what advice would you say, just based on lessons learned in life, that you might want to share with the audience?
I like the lesson that everything is temporary, whether it's good or bad.
Okay.
And that is what got me, any of these times that popped up in my head just now, I think that got me through it. So whether you're on like a high, you gotta be humble and ride it and know that this is a blessing and you were given this opportunity, and to seize it and be in the moment and enjoy it, and know that eventually someone else will have their moment and be happy for them. And if it's a low, know that time will pass and you distract yourself and then it'll go up again. So I think in any of those memories that kind of just surfaced, that was the through line.
Yeah, I think that's very, very important advice. So thank you very much. Keeping an even keel and not letting yourself get too high or definitely not dwelling too low. I think that's very important. Last question.
Yeah.
I wonder if this has changed. We'll have to go back on the old tapes and see what you had.
I know. I wonder what I said.
You know the question though. So
yes.
Everything you've accomplished, all the amazing things that you're doing, how much of that would you say is hard work and how much is luck?
Oh, I answered this one and I have the same answer. So I really, really have the same answer. I think it's a lot of, you got to be at the right place at the right time. But if you did not prepare, you did not put in the work, you did not hustle, you did not do all the things that it takes. I think we always see this stage, which is why I wanted to know sort of how it started, because it's so interesting to hear like those kind of like clawing your way at the beginning is what gets you there. But if you don't put in the work, I don't think the opportunities will present themselves. I don't think you will be in flow if you don't show that you deserve that flow.
So true.
That's
so
how
true.
I really
you know, it's funny, over the years I've had multiple people say, oh, you're at the right place at the right time. And I'll say, well, you know, funny enough, I was at a lot of wrong places before this one.
Yeah, exactly.
And if I wasn't knocking on all those doors, I wouldn't have ended up in this place.
Yeah.
So certainly I think it is that preparation meets opportunity type of conversation.
Totally.
I love that. Okay, so thank you again. You're amazing. Thank you for everything that you do. Thank you for being an amazing friend.
Oh, thank
Any other
you.
final words of wisdom? I should give you one more chance to say something. Anything we didn't talk about?
One more chance. No, we talked about everything. This is essentially like when we chat on the phone and we just...
We've said it. I've said it so many times. Like, we could have just recorded this conversation on the phone and made it a podcast. This essentially was one of our phone conversations. We just had a beautiful setup here.
Yeah, because when we chat, or whether it's about a patient or whatever, it always kind of turns into a lovely conversation that I'm always grateful that we have.
Thank you. I'm grateful for you as well. Thank you so much. I am also grateful for OSI for giving us the space here. Once again, we are at the White Oak Resort, beautiful resort here in Niagara-on-the-Lake. So big thanks to OSI. We're here for the OSI Summit. Actually, I'll give another quick shout out on that note. If you're a private practice owner or associate and you're looking for a group network to be part of, we've been with OSI for a couple of years and we've been very happy. So I would encourage you to just look into it. So thanks to OSI. And again, big thanks to our team, LCA Productions, who've been sitting here. It's cold out here. They're like shivering behind the camera. We have a nice fire pit to keep us warm. And thank you, of course, to everybody who's listening and watching the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys in the next episode.